guys, my name is Carly and you're here watching Office Hours, a live Q&A session to meet with SAU professors and faculty members. So here today we have Deb Frankie-Lasher and Heather Scott, and we will be talking about the nursing program.
Thank you for having us.
Hi. So, do you guys want to start off just by giving a brief introduction about the nursing program, anything at all?
Sure. Or about us, right?
Sure, yeah.
Sorry. As she said, my name is Deb Frankie-Lasher. I'm the nursing advisor recruiter here for the nursing department. And I've been working with the nursing department for going on 5 years. I enjoy meeting with all the families and getting everybody ready to enter the program.
I'm Heather Scott. I am in my 4th year as faculty at St. Ambrose. I graduated, I'm an alum of the nursing program, graduated in 2007. And I teach in the skills and simulation lab, and I've also done clinical in the hospital at the acute-based setting for clinical.
Awesome. Okay, so we will start going through some questions. So the first question is, when can a student apply to be in the nursing program here?
So there's a couple of different things that a student can do. When they are in high school and they're deciding to what their major is going to be and they're visiting, they can do an early decision placement application in their high school year. And that is pretty cool because that holds a spot for them in their class that they're projected to join, and that would be in their junior year when they start nursing here. And then they can also apply if they're transfer students as well, and that would be in their sophomore year, college sophomore year. So we have 2 admission cycles, fall and spring. So we've got a lot of students coming through.
So the next question is, how many students are accepted into the program each year?
So we have 56 students that enter our program in the fall, as well as 24 that will be entering this fall as well in our BSN Accelerated program, which those are students that have a non-nursing bachelor's degree already. And then we have 32 that enter in the spring, and we also have our RN to BSN students, which they hold an associate degree in nursing and are now looking to get their bachelor's degree.
Awesome. So the next question is, what is the NCLEX test?
So the NCLEX is the licensure exam that after you graduate from a nursing program, whether it's a BSN or an associate's program, you graduate with a degree, but then you have to pass the licensure exam to actually be employed as a nurse in a facility. So it's good for, it's a national examination, so you could go to school in Iowa, take the exam here, and then go work in Utah if you would like. But you still have to then apply for your license in the state that you will be working in.
Awesome. Okay, so the next question is, do students get to pick what type of clinicals they take?
They don't get to choose the setting. We have a couple different settings that students go to based on the content areas of the classes that they're taking in that semester. So for the first semester students who are just starting the nursing program, they're learning a lot of their fundamental skills, a lot of that basic information, the basic content. So they go into a long-term care facility or rehab facility where there's a larger geriatric population, so it's very focused on the geriatric population. And then once they get to their second semester, they start in an acute-based. So currently we partner with one of the local hospitals in the area, and our students go to several of the different units on at the hospital there. The students don't get to choose what unit they go to. However, we use some of those same units when they go on to their 3rd semester, so when they enter their senior level in the program, and we try to kind of space them out so they're not going to do both semesters on the same unit to kind of give them a little bit of variety.
Yeah.
And then once they get into their last semester, their 4th semester, right before they graduate, they'll do a preceptorship. And that they do get to pick their top 3 areas that they'd like to do their preceptor course in, and our faculty member who that's her specialty. She chooses all the preceptors, hires all the preceptors, and sets those up. Will try and match the student with their top picks. So in that sense, they do get to choose. They don't always get their number one pick based on the availability, but she tries really hard to get them in one of their top picks to really get them in an area of interest that they want to
And it's
more
cool, they do
experience.
160 hours with that nurse one-on-one.
Yep.
So it's very cool, they're here 2 days a week for didactic classes, and so it's a very good experience just before they graduate.
Yeah, and it's not just limited to the Quad Cities. We have students that go to Dubuque, they go to the University of Iowa. So
And Des Moines.
yeah, again, it all just depends on the availability of our preceptors who put in for the positions, but there's a lot of really good variety, maybe experiences that they don't get in their clinical courses throughout the program, that they get to experience that before they're out in the practice setting.
Yeah, that's amazing. Sounds like there's lots of opportunities.
Yeah.
So the next question is, what are some classes students can take their senior year of high school to prepare for the nursing program in college?
When I visit with students in high school, there's so many now that are taking dual enrolled classes through their local community colleges. Some are graduating with associate degrees already. So it's nice when they do come early. I'm seeing sophomores and a lot of juniors coming. So then we make individual plans for them, and they know what classes that they're going to take. And a lot of them are getting their CNAs early and working as a CNA, which is awesome. That's one of our requirements as well. So sciences are always the best, biology, chemistry, anatomy, physiology, statistics. So we see a lot of that.
Yeah. So we've got one more question. What are some good study tips for nursing students?
I'd say organization is the biggest thing. Once students get into the nursing program, they find out fairly quickly that it's really unlike a lot of their prereq coursework that they've done. It's very rigorous. Their schedules are really full. There really is a lot of outside the classroom time that they have to put in, and it's, you know, the content that they learn, it builds on each other. So it's not to say students do that, but there's certain classes that they have to take, and it's kind of like, okay, I'm going to get through this class, and then, you know, I'm probably never going to use that again. But these, it just builds on each other. So if, you know, you don't know the content that you are taught and that you are supposed to be learning in your first semester, it's really going to come through, you know, as you're going through the program. So really being organized, and you know, a lot of students want to work, some have to work obviously through the program. So if that's, you know, your case where you have to work or you have other things, you know, going on at home, obviously, you know, everybody has lives out of school, but really kind of getting a good pattern of organization ahead of time so that you can just kind of jump right in and not really have some of the difficulties that we see some of the incoming students have.
It's always good when the students have a good support system.
Yeah.
We talk about that because many students already have families of their own, so they do have responsibilities, and it's nice when they have help from grandparents and their parents to help with their little ones. We see a lot of the students stay here in the building to study and study in groups. We do have tutoring. There's great tutoring on the main campus when they're freshmen and sophomores, and then also here when they're nursing. They always have an advisor to go to. We've got a great advisor, Patricia Madden, on the main campus, as well as they'll have a faculty advisor here, so they always have their go-to people. Our class sizes are small enough to have those available resources for them, as well as our accessibility resource center. Probably a third of our students have testing accommodations or different things like that, and it's just great resources, and it's exciting to see them use that and be successful.
Yeah. So the next one is for Heather. What is your favorite class to teach and why?
I really love simulation. We've really developed our simulation program within the last few years, where we've increased the not only the number of simulations each student is getting throughout the program, but the amount of time that we spend doing those scenarios. myself and the other instructors that do simulation, we try really hard to write scenarios and come up with things that they're doing during the scenarios that really mimic what they see in the clinical setting. And it's kind of nice where we can pack a lot of content into such a small amount of time so that they're getting their assessment skills and, you know, medication administration and different skills like wound care and fundamental skills all in just a very short amount of time. And just really seeing the students working together and kind of talking things out and making those decisions and applying the things that, you know, they know they're learning, but it doesn't really come out how much they actually know until they're in that situation and they have to respond to a patient and explain their lab work or explain why they're, you know, having a certain you know, procedure or medication or something. So it's really fun to see them kind of connect the dots, and then we always debrief afterwards and talk about it, and there's always really good conversation and dialogue. I just, you know, there's some days where we wish we could be here for 12 hours because there's literally that much to talk about, and the students just get really, really excited about it. So that's the best to see, I think.
Yeah, that sounds really rewarding for both you
Yeah.
and for them.
Yeah.
And that's another great advantage. We have the 12-bed skills lab that we're sitting in right now, one of the bays. And then the sim labs, we can have 2 sims going on at the same time. And we've got the high-tech mannequins, so it's very interactive. It's fun when I give tours because we can be behind the mirrored glass so the students don't know that we're there. And Heather's very gracious. We always go in and we don't talk, but the visiting students and parents get to see. So that it's very exciting because the students are in their uniforms. It is very real, and it's fun to see that in action and see what they'll be doing. So we're very lucky to have that for our learning experience.
So the next question is for you. What is your favorite part of the admissions process here?
I really enjoy all of my visits that I have with the students. It's fun getting to meet them when they first come, and especially, it really doesn't matter if they're transfer or high school students, but meeting them, and then when they're finally walking across the stage, graduating, getting their pins, it's exciting because you see that whole process happen, and you know what they've been through. It's a rigorous program, but it's so rewarding. So that's the most fun part, I think, for me.
Definitely. So this one is for both of you guys. Why do you think nursing is such a popular major?
Well, a lot of the students watch Grey's Anatomy, so that starts
I
the
do
ball
too.
rolling.
It's not anything like Grey's Anatomy.
But they do. I do get students that come in and they're like, oh, they're watching Grey's Anatomy. A lot of their families are nurses. It's popular because there's a nursing shortage, so there's always jobs available, and there's so many facets of nursing. So if you don't really like a certain area of nursing, there's so much to choose from.
It's like getting a new job. So if you graduate and you get into, a certain unit or area, and you're like, oh, this just really isn't what I thought it was going to be, it's maybe not for me, you could, look for another job in a completely different area, and it's like a whole new career, really. And I think it's really rewarding. I think it's easy for nurses to go to work and see the impact that they're having doing the jobs that they do, where a lot of other careers, I think maybe that's why maybe people don't enjoy it as much. But you interact with so many different people and are able to touch their lives in so many different ways, and I think that's probably the rewarding part is what keeps people in nursing for so long.
And we have a lot of students that that come in and they've been patients themselves, and that's a big reason why they want to be a nurse, because they know what the nurses have done and impacted their lives or their illness when they were in the hospital. So it's pretty fun. But it's a great career, because you can definitely do a lot of different things over the course, and then when you have families and different schedules and things, nursing just always seems to work.
Yeah, it's really
There's always
flexible.
jobs
It's
that
not
you
that
can-
8 to 5, Monday through Friday.
Right.
Yeah. So now we have a submitted question from Peyton. She said, I'm planning on taking the CNA class this summer at college in Illinois. Once I take the Illinois State Nurse Assistant Competency exams, will that fill the requirement for the nursing program at St. Ambrose since we're in Iowa? If not, what needs to be done in addition?
Hi Peyton, yes, your CNA, that Certified Nursing Assistant, will work from any state, and you just have to take the licensing exam and pass that. And then that will just transfer here. We'll have you print off your profile page when you get ready to come in, and that's something you just keep until you're ready to start the program. Some of the students work as CNAs, and you can certainly do that. We recommend you work per diem so you can kind of choose your hours, especially if you're busy or it's midterm week and those kind of things. Some students just work over their breaks, but it's a great experience because you're coming in with that skill set and building on that.
Yeah.
So, yeah, that's
And
great.
and it's not, like Deb said, the CNA certification is a requirement for admission, but working as a CNA outside of, the clinicals that you have to do to get your certification for the CNA course isn't required. But I think I really see a difference in the students in the skills lab and in simulation who have worked as a CNA or some sort of, even if it's not a CNA, even in like customer service, just working in where you're getting some sort of contact with other people and having to communicate. I really tend to see them as a little bit stronger in that clinical setting, and I think that's what a lot of people struggle with, doing the book work and the didactic coursework and taking the tests and that. Some people it comes really easy to, they just naturally can get that down, but really talking with people and establishing that rapport and that relationship, it's some people struggle with, and it's not a learned skill. It's not something that we can teach you to be a people person. So just the more exposure you have, and honestly, some people, I think they get out in on the units, and maybe they find out it's really not for them, maybe. So working as a CNA out with patients, they get a really good glimpse, and then it can also help them be like, this is what I like, or this is what I know I don't want to do. So it really kind of helps them hone in on those areas that they're really interested in when they get out.
Right, and it helps when they are a nurse to appreciate a CNA and how much
Oh,
they help.
absolutely. Yeah.
It is hard work,
Yeah.
but they do learn a lot of good skills with that. And like I said, they just build on, it's a set of 30 skills that they learn, and when they're here, it's just a review, and then they build on that, so.
Yeah. Okay, so that was our last question. So do you guys have any other final thoughts that you would like to say?
Well, I love St. Ambrose, so come and
Yeah.
visit.
Yeah, our alum, we're always having alum come back. We've had alum come back and be, dad in the sim lab for a pediatric patient when we run a pediatric scenario. Or Dance Marathon was just this weekend, and I volunteered at one of the stations there and saw some of our nursing alum come back. So there's a reason why alum want to come back and
It's a
still
good
be
family
involved.
feel.
Yeah, yeah.
And nursing's hard wherever you go to take, to be a nurse, any program, but I think we do have an advantage that way. It's a good family feel with the faculty and the staff. We've got great staff, so.
Yeah.
Thank
Okay,
you for
so,
having us.
Yes, thank you too for being on Office Hours. And that is all we have for today. So thank you for watching, everyone.
Thank you. Bye.